Diabetes. Diabetes is a chronic health condition that impacts how the body turns glucose or sugar into energy. When you eat, your body will break down most of the food and turn it into glucose. That glucose gets released into the bloodstream. As blood sugar rises, it sends a signal to the pancreas to release a hormone called insulin. Insulin acts like a key that opens the door between the sugar in the bloodstream and the body's cells. Once absorbed into the body's cells, it can be used as energy. When the body stops producing or responding to insulin, which is what happens with diabetes, there is a buildup of sugar in the bloodstream that can lead to damaging effects such as peripheral neuropathy, diabetic retinopathy, kidney disease, and heart disease. So with diabetes, there are a couple of things that can go wrong. First, the body might not make enough insulin to keep up with the sugar in the blood. The body might have trouble utilizing the insulin being produced, or no insulin is produced by the pancreas. Type 1 diabetes is also known as insulin-dependent diabetes. It's often present in children, teens, and young adults, and it represents 5 to 10% of the diabetic population. Type 1 diabetes is an autoimmune reaction, which means the body is attacking itself. With type 1 diabetes, patients require insulin for the rest of their lives. Type 2 diabetes is also known as non-insulin dependent diabetes mellitus. The pancreas produces insulin, but the body is resistant to it. The pancreas struggles to control the amount of insulin in the blood. Eventually, the cells resist the insulin being produced, which is known as insulin resistance. Over time, the cells that produce the little insulin the body is creating get worn down and may eventually stop producing insulin altogether. Type 2 diabetes represents 90 to 95% of the diabetic population. It's usually diagnosed in adults. However, with child obesity rates rising, it's getting diagnosed in younger children. Type 2 diabetes may be treated with oral or injectable medications, diet modifications, and exercise. Gestational diabetes occurs during pregnancy when the blood sugar gets too high. It usually occurs mid-pregnancy, so 24 to 28 weeks. With gestational diabetes, the pancreas still produces insulin, but the pregnancy hormones, estrogen, cortisol, and the placenta-producing lactogen block the effect of insulin. Gestational diabetes may resolve after the birth of the child, and it's managed with medication, diet, and exercise. Some signs and symptoms of diabetes are increased thirst, increased urination, increased hunger, fatigue, elevated blood sugar, blurred vision, slow healing cuts or sores, numbness and tingling in the hands or feet, and an increased number of infections. People who have diabetes have an increased number of infections because the high sugar levels in the blood allow bacteria to grow and infections to develop more quickly. Some long-term effects of diabetes include diabetic retinopathy, which is a vision impairment that could lead to blindness, diabetic neuropathy, which is nerve damage, most specifically found in the feet, foot damage due to poor circulation, diabetic nephropathy, which is kidney damage, heart disease, more prone to infections, and hearing impairment. Hearing impairments occur in people with diabetes because over time, the small blood vessels in the ear get damaged. Hypoglycemia is a condition in which your blood sugar or glucose level is lower than the standard range. Glucose is the body's main source of energy. Hypoglycemia is often related to diabetes treatment. Symptoms include change in level of consciousness, skin that's cool and clammy, complaints of headache, being shaky, and feeling nauseated. Some CNA interventions are to notify the nurse immediately. If the patient's conscious, the patient can have some orange juice or peanut butter crackers to get their sugar up. Some causes of hypoglycemia are taking too much insulin, drinking too much, liver illness, long-term starvation, and hormone deficiencies. Hyperglycemia is high blood sugar. The glucose in the bloodstream gets too high. Causes include overeating, not getting enough exercise, not receiving enough insulin, illness, infection, injury, emotional stress, and certain medications. Hyperglycemia doesn't usually cause symptoms until the blood sugar levels are high, well above 200. The longer the blood sugar levels stay high, the more serious the problems. When a patient starts to experience symptoms, their skin may be warm and flushed. Their breath may have a fruity smell. Blood sugar, when tested, will be elevated. They might have abdominal pain, nausea, vomiting. They might be confused or have loss of consciousness. CNA interventions for hyperglycemia are to notify the nurse immediately. Some guidelines for caring for people with diabetes. Maintain a consistent meal schedule. Encourage clients to follow diet orders and not eat concentrated sweets. Monitor blood sugar per facility policy. Inspect the client's feet and toes every day for blisters and/or reddened areas. Ensure the client always wears well-fitting shoes when ambulating. If the client has a loss of sensation in the hands, assist with eating, writing, and holding objects. If a client has loss of sensation in the feet, assist with ambulation. Always dry between a client's toes after washing, and never, ever, ever cut toenails. Only a podiatrist can cut toenails. Some things to report to the nurse if the patient misses meals. Complaints of increased thirst, urination, particularly at night, and blurred vision. Changes in level of consciousness. Skin that is cool and clammy or warm and flushed. If the client is eating sweet snacks between meals. Cuts, bruises, or sores that do not seem to be healing. Blisters, sores, redness, or cracks on or between the toes or on the feet. And any increased incident of infection.